11:45, and our next guest is Dr. Shad James. He's a homeopath, and the last time we spoke with him was during COVID. I think it was it just pre-COVID? I remember not consulting with him, but I remember going over and picking up some sprays, some throat sprays, and I'm going to ask him to talk to us about that for a minute or two, but also what they're doing at UNISA, some specific lab tests, and how that's going to help us as South Africans move forward as far as COVID and other viral infections are concerned. Dr. Chad James, a very good morning to you. Welcome to the program.
Good morning, Julie. Nice to joining us. Thank you.
Thank you. Thank you for your time. As I've indicated, I think we spoke on a show pre-COVID, and then COVID happened. And then I'd heard that you had come up with a throat spray, which of course I got a couple of bottles of. I must admit, I haven't finished using them. Is it still good to continue using them on a needs basis?
Yes, on a needs basis, definitely. You don't have to use it every day if the probability of you getting the virus isn't there. So, for instance, while we're not in a spike of this actual virus or the pandemic, I don't feel it's necessary. But I find a lot of patients also have said that it's helped them prevent other colds and flus in this season. So it does help with that. Some have reported that it helps the sinusitis as well.
Okay.
So quite interesting.
All right. I must say that I used it for that while, and every time I got a scratchy or an itchy throat, I went to the sprays, and I used to use the spray, and it very definitely did give me relief. But in conjunction with other preparations that I was taking as well at the time. So I just kind of wondered, are you still big into those sprays? What else during COVID? How else were you treating patients?
Well, that was one of the main treatment options that I gave to my patients, because I found it really did help. It decreased the intensity of the symptoms and got them out of bed a lot quicker and feeling better. And also it stopped them from spreading it throughout their households, which was also very important, obviously. So it really did help in that sort of way. I did suggest, the usual vitamin C's and D's and multivitamin and zinc and so forth to take, while they are sick. It does help, definitely does help alleviate the symptoms. But yeah, it's like any cold or flu. You just have to go through the process, and it's pretty much trying to make the patient feel better as they're starting to shed that virus and, get better and shorten that convalescent period, obviously.
Now, you're a homeopath, and I hear you talking about vitamins D, C, zincs, etc. Do you not have alternatives, or are you happy that your patients go that route, that they take those multivitamins, or is there a suggested alternative from your part?
Look, those are just supplements at the end of the day. They're neither medicine, they're neither homeopathic or allopathic medicine. They're just supplements. It's pretty much the same sort of vitamins and minerals you get out of a very healthy diet. So somebody that's very healthy and didn't feel the need to use these things would not need to use it, obviously. So both GPs, homeopaths, or physicians would prescribe these things to their patients. And so that's sort of a blanket between all of us that we all gave to all our patients. So that's in any practice you'd find them prescribing these supplements at the end of the day.
I do know certain people who have continued taking those supplements. I'd like to say post-COVID, but we do know that the fifth wave is on the horizon. Is that good practice to continue with all of these supplements?
Yes, I wouldn't overload with them. I just do the recommended daily allowance. I wouldn't do it every day to an extent that it's actually going to become problematic or problematic financially. Obviously, if you do get ill, you take a higher concentration of this. But for now, yes, if you just carry on with those supplements, it's fine. I don't push supplements personally out of my practice. I feel if you're fairly healthy, you should be fine. If you follow a good diet and you exercise and so forth, it should be fine. But obviously, if you're lacking in any way, if you unable to eat a healthy diet, or you are unhealthy or have some sort of pre-existing comorbidities and so forth, yes, I'd say definitely the supplements are something to look at for that sort of patient. And
Now,
to
I
actually,
know that, carry on.
no, that's all.
Okay. I do know that your wife is a medical doctor and you're a homeopath. I just wonder how she views your practice and your, treatment modalities, being a medical doctor.
Well, she's an anaesthetist, so but she
Ah,
was
okay.
obviously before that she was a medical doctor and saw patients as well. But well, she used the spray, and many of her colleagues use the spray.
Wow. Okay.
Nobody has any problems with that. They see the efficacy. They're happy with what it's doing. I have a very good relationship with all normal medical practitioners and specialists and so forth. And yeah, I mean, I run my practice like a GP practice. I consult my patients in pretty much the same way. It's just the medication that I use may be different. And if I feel that an antibiotic is needed, I get a GP to prescribe that for me, and we use that sort of medication, and I work along with specialists and so forth with patients if we have to introduce a herbal medicine or anything to make sure it's not interacting with any of the medications that they're already on. So I work very closely to conventional medicines. So there's absolutely no friction.
Okay, the one very important question, Shad, is the issue around. We do know that multivitamins sometimes interfere with conventional medications. What about homeopathic, the alternative medications? Is there a risk of that happening?
Not really. I would say in homeopathic medications, they very rarely do find interactions with a conventional medication. You usually find your interactions usually happen when you start using physiologically active medications such as herbal medications. Those You must remember that a lot of your conventional medication is based initially on herbal medications and compounds and so forth. Exactly what we're doing right now with this research we're doing at UNISA is actually it's going to end up becoming a conventional medication at the end of the day. It started as something herbal, but it will end up, um, in the dispensaries one day as well. So that's where you have to watch out, and that's where you really have to know what are they working on the same receptors in the body, that you're not duplicating the medicine or blocking that conventional medication and not giving the patient the treatment that they need because you're actually blocking the conventional medication with the herbal medication. So that is, yes, you are right. There are interactions there, and one has to be careful of that, obviously.
So obviously you do need to, when you go for a consult with a medical doctor or consult with someone like yourself, very important that you give your history and also indicate the type of supplements and meds that you might be on, herbal or otherwise. That being said, let's go to the issue around the test that's being carried out at UNISA. Did you initiate this? How did this all come about? And what are we looking at here? Because you use the word herbal, and you're also suggesting that eventually, once these tests or trials come to a close, you probably will be, this is going to be a conventional medication that's going to be available. So exciting, I should imagine.
Very exciting. It's early stages, but we're very excited. I started working with UNISA last year with Professor Samantha Geldenhuys and Dr. Masebi. And they started doing the experiments in the lab on the compounds that we isolated from the herbal spray. That herbal spray that you bought, we took the herb, we looked at the herb that we put inside there that was actually doing the work, isolated the different compounds, and now we've been exposing these compounds to the actual coronavirus and seeing how do they interact. And on one of the compounds, thus far, we find a really good interaction and a really good binding on something called the nuclear capsid protein. And that's a very intricate part of the actual virus structure itself. And it's played off in both ways, that it can either be used as a prophylactic sort of
Wow.
measure as well as a treatment measure in this sort of case. So we're really excited with those results, and we're just carrying on from there. Yes, but
Wonderful. When do you think you're going to reach the end of the trial? How soon? I mean, this sounds exciting for all of us, and we obviously would be keen to get our hands on it once it is available. But I should imagine this would then be something that would need to be prescribed.
it depends on what sort of. It probably would be prescribed at the end of the day. Obviously, when you start isolating compounds and so forth, and you start concentrating them in a medication, that you might start finding that you're getting a lot of side effects along with it, because it is that effective. So now the next part of these sort of trials or laboratory sort of tests we're going to have a look at is how concentrated does this compound have to be effective, and at that concentration, is it still safe to use in a human being? So that's the next thing, seeing that safety compared to the efficacy and seeing, are we going to find an optimal range where we can actually use it, and look at the dosage and so forth, and what would be effective in the long run. But yeah, so it's a long, this is the long process. It's when you start actually isolating these compounds and looking at what do they do and how safe is it to use. For instance, in the herbal preparations that I've done, they're very safe to use. It's a local spray that you use. It lasts a few hours. It goes away, and that's it. We're looking at these sort of things that might actually have quite a long half-life and so forth. So we have to look at all these sort of things. So it's very early stages, but we're trying to push it as hard as we can as well from our end.
Is this specifically for COVID, or would it cover other viral infections as well, like your MERS and SARS, and possibly even flu, the common cold and flus?
Yeah, that's all dependent. I mean, obviously, our initial testing is all on COVID-19 only, and we are actually exposing it specifically to that virus. Obviously, if you're going to find a cold virus or flu virus with a similar structure, it might have the same sorts, indicate that it could work for that as well, and one could test it on those as well. And also, a lot of these sorts of coronaviruses have similar structures, so there's a very strong possibility that this could be used in a much broader area of treatments in specific viruses and so forth. So yeah, it shows a lot of promise for that. So if we're getting a structure in a virus that is similar to the COVID virus or the coronavirus, then definitely it will have an effect at the end of the day. Not every single flu, because many flus have a completely different structure at the end of the day. But if you can pretty much cover most coronaviruses one day, it's not going to be a problem for human beings anymore. They'll probably have to worry
Okay,
about them.
absolutely. Is this a collaboration with the doctors or professors at UNISA? Did you
Yes.
come up? Did you and were you the initiator of this? Is that the right terminology? The initiator.
Well, let's put it this way. I started with e-spray and first saw that it really does have an effect on my patients, and it is protecting a large community of my patients before I approached somebody that could actually start these sorts of tests. Obviously, the tests that we're doing now are very specialized. It's biochemistry and chemistry. It's something somebody has studied a lot in, something that I don't know a lot about in these sort of tests. So the clinical side of things, what I'm pretty much be working with, but what they'll be doing is an actual lab test. So yes, then I did contact them. I said, I have something that might be of interest. Can we have a look at it together? And yeah, they're very keen from the start, very excited about it from the start, and they really knew what to do from the start. They knew exactly what they had in line immediately. We isolated what compounds we needed. We started with those sorts of things, got those compounds, got the actual virus itself, and from the get-go, the results have been quite phenomenal. I feel that binding was really good on the nucleic acid protein. So that's where the promise lies, because in that specific protein, it's stops the replication. So once, even if you haven't been using this medication and you haven't been using it prophylactically, sorry, and say you have caught a coronavirus and you are now ill, you can actually use it as a treatment because it stops the replication of that virus. In doing so, you will have less aggressive symptoms, be a less, you'll find less people having to need to go on oxygen or go to hospital or anything like that, and just become like getting over the common cold at the end of the day. But the prophylactic side is also what is really important to stop the spread, because it actually would hamper the process of the actual virus attaching itself and spreading to another human being. So that's also a nice thing to look at on that side. So it was really good that it actually binded to a specific protein that works on both sides of the page.
Are you aware if there are any other such trials happening anywhere else in the world? Because obviously, I think the whole world are wanting to get on board to get a cure for the coronavirus, because we just see that it just keeps mutating into a different, type of, you just get over the one, then
Mm.
it's the Delta, and then it's the Omicron, and, just seems to be an ongoing process here. So are you aware of, similar trials happening elsewhere in the world? Have you tried hooking up with them to see where they're at, or is this all kind of really a big secret for now? Because the big farmers, obviously, it's big business for them, because lots of time and resources are spent in developing these treatments. So I just kind of wondered, how open are they about these type of tests? And then, of course, are you going to go the clinical trial route? Are you going to ask for people to come on board and undergo the trials, take the actual spray or whatever form it comes in, to see if it is in fact effective, if it is going to be the wonder treatment that you're hoping it's going to be? I hope it is.
Yes, well, there is definitely many trials going on around the world. There's a need for it. Even if we get over this whole coronavirus for now, it might spread again, it might come back again. SARS and all those sorts of things are similar sort of viruses. So we do see they do repeat themselves. So it's something to keep in the bank always as a good treatment. So definitely people are still looking at different treatment options, and there are trials going on around the world. Not only in the vaccine routes, obviously that was the conventionally one was looking at as many vaccines as possible and effective vaccines at the end of the day. And we have found that, yes, okay, maybe it doesn't stem the spread as much as we'd hope for, but it does stop the disease being so problematic that you're getting people ending up in ICUs and so forth. So definitely the vaccines have worked in that respect. That's really good. But the treatment options, definitely a lot of trials going on at the moment. Everybody's looking at that. So that's pretty much where the focus is right now. And yeah, we're just one of those teams looking at that sort of thing. Obviously, we have to get a lot of knowledge about what we're doing before we perhaps approach some a pharmaceutical company, perhaps, or somebody to actually push further trials and so forth, because obviously that's where the money, it costs a lot of money at the end of the day when you're going down that sort of route. So obviously we doing it through UNISA, there's limitations in these sorts of things. So we'll be looking at that eventually, I guess, and anything has to undergo a clinical trial eventually. So everybody's going to go through that, and when we get to that, we'll cross that bridge when we get to it, obviously.
Absolutely. And I don't think, personally, I feel that it couldn't come at a better time. The sooner, the better. We really need that. Uh, and I'm going to be pretty dramatic when I say this, but almost like a silver bullet, so to speak. We need that something that's going to give hope to people, because we have been through a dreadful time these past 2 years. Having said all of that, then, Dr. Chad, uh, give us a ballpark figure. When do you think that, you've really now got us all interested and hopeful? How soon before this preparation, be it in the form of a prophylactic or be it as an actual treatment, how soon will it go to market?
Well, to market is difficult to say. Exactly. It's just about getting the interest in the actual trials. We have really good, from the university side, that's the interest is excellent. And obviously we are pushing along those sorts of routes. But yeah, it's hard to say. We're looking at probably in a year's time. We'd rather have it sooner, But there's
Of
also a lot
course.
of other compounds within that herbal remedy that are made that we still have to look at. So I mean, this is only one of the compounds, and it's already shown so much promise. So we
Wow.
hopefully be some more of that and quantify on that. So we really have to. It's hard to say. It's a difficult thing to
And I
predict.
suppose,
I think
I suppose now it's even difficult for you to say what the end product would look like, whether it's in a spray form, whether it's injectable, whether it's in a tablet form, etc. So early days yet, but good on you. Glad that you're down this path. What about people, interested parties who want to get hold of you to have further discussions regarding this, this medication or this wonder drug? How do they get hold of you?
they can email me or phone me. That's not a problem. I don't know if you have my details to post on your website, or I don't know how that would work. Yeah,
Are you on Instagram? Do you have a website? Are you on Facebook?
I'm on Facebook, but probably
Okay.
best to email me is probably the best way to get hold of me with these sorts of
Okay.
things. Yeah,
Great.
so
We've
it's
got your number, and you don't mind us giving out your number for interested
no problem.
parties.
Yeah.
Uh, Finally, just to, if there's anything else important that you want to share with our listeners and viewers before I let you go, maybe a question I haven't asked, an important enough question I haven't asked.
No, I think that's about it. We just wanted to share where we're sitting at with this sort of trial. And I mean, last year when we spoke, I think it was January, we're getting really good effects on just the spray alone, So we've come a long way since then, I feel. So I think things are looking, on the up with that. I see that the incidence of COVID infections have started rising now after the long,
Again, yes, yes.
especially this Omicron BA4 and BA5. But fortunately, it doesn't seem to be as deadly. It's contagious, quite contagious, but fortunately not as deadly, especially if the patients have been vaccinated. And you find that in the ICUs and so forth at the moment, it's generally unvaccinated patients. So I would ask any viewers or anybody that's listening that is a really good means of protecting yourself right now, is definitely making sure you have the vaccine. Might not stop you from getting COVID, but it would definitely decrease your chances a lot in ending up in an ICU. Okay, so I think that's something people should just be reminded of. And yes, mask up and sanitize, use your supplements,
Absolutely.
so that they're working for
Absolutely.
you. And yeah, so
Dr.
that's
Chad, James, thank you indeed for chatting with us. We look forward to this preparation or this medication hitting the shelves. Please do give us a heads up once you get some definite news from the rest of the team. You are a homeopath, you're based in Johannesburg. So if people do want to get hold of you, they can contact us and we will gladly pass on your number. I guess they could Google you as well. The
yes, that
information would be
yes, that'll
okay.
be
Brilliant.
okay.
Nice talking with you. Go well. And please keep us in the loop once you
Okay,
get the good news.
we will do. Thank you very much, Julie, and have a good day. Thank you.
And you. Lovely talking to you. The time is 12:10 exactly. That was Dr. Chad James. He's a homeopathic practitioner. He's come up with a preparation. It comes in a spray form, and the moment you feel a tickle in your throat, or if you are being treated for a cold or a flu or even COVID, That is the treatment modality from him. I've personally used the spray, and I must say it has given me a lot of relief for a very, very scratchy throat. But you've heard the good news from him. He will be keeping us posted once, this preparation that they are busy trialing at UNISA goes to market or is about to hit the market, or the pharmaceuticals. So we will keep you posted on that issue. Still to come on the show, we're going to speak to Magdalene Moonsami regarding sexual harassment in the workplace, and we will wrap up the day with Ahmed Amanji regarding your retirement. It is 10 after 12 right here on Salam Media.